What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. In today's video, we have a little nighttime special for you. So, you're curious, is it harder to be an X-ray tech or is it harder to be a nurse? Schooling edition. So, to give you context, I've been doing this for 4 years. Night shift. My lady is a nurse. We both sat down and talked, and I've gathered the knowledge I needed to make this video. So, in simple terms, it is easier to go through the X-ray tech program than it is to go through a nursing program. That being said, both come with their own challenges and their own things. None of them are easy by any means. Nursing, on the other hand, has a lot more challenging, both based off of the medication, the documentation, and how the clinicals and all the classes and all the other stuff works out. I'll just let you know that. They do make more money than X-ray techs, but at what price? I always look at my lady. She's super stressed all the time. I'm here stress-free majority of the times. Just keep that in mind. That is something to deal with. Now, as far as availability goes, X-ray tech programs are a little bit less versus nursing. Almost every college that I've seen has nursing. X-ray is just a little bit less. So it is harder to find places to accommodate for our program. There's different levels. There's like the bottom tier is an associate's degree. There's bachelor's degree, and then I think nursing you can go up to the master's. I don't think X-ray has a master's degree. If you're going for X-ray in the master's, it's like if you want to be a teacher and go through that, or educational, or being more of a management role at the hospital, wherever you want to work at. Just putting that out there. So clinical wise, we go to different hospitals. Usually it's hospitals. Sometimes you go to some few urgent cares and stuff like that. My lady, during her nursing school, she went to a hospital. She went to retirement homes. She went to little urgent cares. She went to various different different spots, oncology places. There's different clinics, way more. And their hours are a little bit different. They had the infamous 5 a.m. to 5 p.m. overnight, 7 to 7. They're just a little bit more hectic. Ours was kind of just the daytime, and then we had 1 week of just trauma, which wasn't true trauma overnight. It was from 2 p.m. to 10 or 11 p.m. And it still is like that at my hospital. When the students come by, it's still running that same type of schedule. Now, as far as pay wise, for school, they're both kind of expensive. Nursing obviously is going to be, I would say, an extra, if you're just at the bottom tier, probably an extra $5,000 to maybe $10,000 more to go through the nursing stuff. That's a little bit more pricey versus the X-ray tech program. I could give you exact numbers on the X-ray tech program because my parents had to pay for it. Our program was sitting, just the program itself was sitting about $16,000 just to go through the program, and then probably an extra $5,000 to $6,000 for all the pre-request courses, and then the actual application and to get into stuff like that, which nursing accepts way more than X-ray tech. I think my lady, she told me when she applied there was 50 slots. In X-ray there was between 20 and I think 25 slots. So I've heard some places offer up to 30 sometimes. So nursing programs usually, my lady said they offered the entrance was 3 times or 2 times throughout the years, and then where I went there was only 1 time you could apply, and you could just apply as many times as you want. So there's that aspect of it. Now, as far as job opportunities goes, there is a little bit more opportunities for being a nurse. My lady has told me all the places she can work at, and half of those I can't work at. Usually you'll find X-ray techs at hospitals, private care, urgent cares, and some of the private or opening imaging little sites. Those are kind of where we're kind of limited to, or mobile, and then the travel X-ray techs, of course. You have those opportunities over there. Let's see what else. Now, as far as scheduling goes, as far as like work life and stuff like that, it's easier. Like, I have more work-life balance than my lady goes, less stress. It's easier. Now, as far as shift goes, she probably has a little bit more. It all depends on kind of where you work at, but she has a little bit more availability in slots and stuff like that. Because with nursing, like at my hospital, there's only 2 X-ray techs overnight. There's probably at least 100 nurses at where I work at overnight, versus daytime probably 200, maybe 250. And I was surprised to learn from my lady that even if your floor or wherever you work at is slow and they don't have that many patients, they can throw you on a different floor and you just take over the gig. And I'm like, that's weird, because like ours, if you just work at the emergency room, like that's it. There's no more other places they can put you, unless like you work at the main or like the outpatient building. But there's only a limited amount of slots. So there's that, if some people see that as a downside. Like mine, where I work at overnight, like I'm just gonna be in the ER and then I'll go upstairs and shoot some people on the floor. Like that's about it. Let's see what else. Pay wise, she makes a little bit more money being a nurse, but since I work the nighttime, I make more money right now. So that is the plus side if you're working. And even like nurses week versus X-ray tech week, the nurses get more credit and more stuff like that. If you care about that, I'm just putting that out there since it is nursing week. Let's see what else you have. I think that's a good summary between both of our fields. So if you're curious, if you check out my channel, it is more heavily focused on the X-ray tech world because that's what I do. You can learn a lot from me. I literally post almost every single day at different aspects of this beloved field. Little tiny niches video on certain stuff that I wish I would have known, both in the program, before I got in the program, and actually in the field of work. Which a lot of good videos out there for those who are curious. And yeah, it's been your boy Miguel. See ya on the next one.